it's already measured out and measured. So kids usually get half of the,
Any questions on?
epinephrine 0.3, that's 30 milligrams, 0.15 is
There's also
15.
delayed hypersensitivity, so this is going to be type 4. So it's also following re-exposure, but it's a different type of reaction. This one's not going to be life-threatening, meaning as quick of an onset. So this might be the patient walks in and they're sitting down, you haven't even started treatment, you're just reviewing their medical history, you're verifying their date of birth, and then they're saying, I'm not feeling so well. I ate something a couple of hours ago. Maybe it's that, I'm not sure. It could be a number of things that cause this delayed hypersensitivity. They might start also getting redness and itchiness on their skin. They might say, you know what, my lips are starting to tingle. I had walnuts in that brownie, but I don't think I'm allergic to walnuts, but I don't know, now my lips are a little tingly. These are just some typical reactions that you might hear, or things that you might hear. And then swelling. Wheezing is kind of later on in stages. And if you question them, well, did you eat anything on your way here? Did you touch any dogs or cats? Were you around them at all? They might say, yeah, but that was yesterday, and I was at, I picked up my daughter from the house, and she had the sleepover, but oh yeah, I did laundry today, so I was touching all the clothes that were filled with dog hair. It could be a number of things, but you might be able to get some, just a history by talking to them and asking them the questions, just to find out if it's more of a delayed hypersensitivity. So what you're going to do is you're going to try your best to identify what caused it. Sometimes it could be our medications, but we usually will not hear about it while they're in the chair. If the patient is having a reaction to something that we're doing in the chair, it's going to be the type 1 reaction, because they're only with us for about half an hour to an hour with from the time that we administer medication. If they call up afterwards saying, I saw you this morning and now it's 5 p.m. and I'm getting really itchy, that could be, then you might want to question them further to find out, was it a medication? Was it the latex? Was it something that we did in the office? So main thing is going to be try to identify what the factor was, and then what the time interval was. As long as they can breathe well, then Benadryl. And then Maria, if you can grab the medicine kit and then find the Benadryl in there. So if the patient's in the chair and they're saying, I'm getting really itchy, and you've been able to identify it maybe as a pet allergy, then you can give them the Benadryl while they're in the chair, and it'll help to stop the itchiness. But you do want to caution them, it's going to make you sleepy. And how long is your drive home? Just be aware you might be tired. We might want to have somebody come pick you up, or I'll give you the Benadryl, but you're going to be really sleepy, so we're going to stop the treatment and send you home. Let the provider, thank you, Maria, and then discuss it with the provider as far as continuing treatment. But usually once you give the medication, you're going to want to send them home. They're going to want to just go to sleep.
And this is for the kids?
For the kids, it's a liquid form, and then the dosing...
We have the tape there. Yeah. For children under 2, well, they say do not use, so I guess not for babies. But children 2 to 5, only children 6 to 11, 5 millimeters.
Is that 25 per 5? How does it come?
For, they didn't say, they said 5 to 10.
But on the front where it says the name, what is the number underneath? How many milligrams per 5? Is it a number with a slash and then 5?
Twelve point five or 5 is probably
12.5 milligrams.
And, yeah.
12.5, okay. Hypoglycemia, we've got a lot of diabetics, and some of them manage their blood sugars really well, others don't. I know we talked about maybe having a stick meter chair side. Is that something that we're still looking into?
Or even just testing it.
Are we gonna
part of
make
our
that
exams.
policy for like, cause we have patients who come in sometimes and their last ANC was like 11.
Yeah.
And I'm like, oh god, you know,
Yeah.
seeing it. And then they're not on any medications, they don't take them, they're not checking their sugar, so that makes me uncomfortable seeing them in the chair, you know, just, so is there any, like, are we gonna have that where we can just test on those patients? Or?
We thought about it because we can actually bill for it too. There is a CDT code where we can bill for glucose testing. Again, just not at the moment. In a few months. But yes, it's on there. It's on our to-do list.
We'll revisit that question.
It's there.
And
So,
would that only be for diabetic patients we would test?
It probably wouldn't hurt to screen everybody. It's kind of like blood pressure. If they haven't been in and, you know, to see their MD in 5-6 years, they could be diabetic. We have no idea.
you can also have non-diabetics with hypoglycemia. There are teenagers that want to look a certain way and they just don't eat. They will not eat, and they'll only eat in the evening time when they're with their family, so it's a show. So they may come in and they may have these signs and symptoms, and they might be hypoglycemic as well. But it's kind of a game trying to figure out the puzzle pieces and what the picture shows you, and that's what we are. We're trying to figure out what the signs and symptoms, what could it possibly be as far as a diagnosis, and then treat it accordingly. They're dizzy, they might feel faint. One of the first things I would do is, have you had enough water, especially with the older population? Have you had enough water, and then have you eaten? When was the last time you ate? They might be complaining of hunger, or I'm feeling really tired, I don't feel well. A lot of sweating, that can happen as the progression of the signs and symptoms. My heartbeat is really, really fast, and then with heartbeat, they might go into anxiety. Headaches, I've got a really bad headache, I don't feel well, what am I here for? Goes into mental confusion. I thought, no, I'm not seeing you today, wait, what am I here for? And then you keep repeating yourself because they're just not able to stay focused and a lot of confusion. Eventually they can go into loss of consciousness and they can faint on you in the chair. Okay, I'll go fast. So treatment, but this is what we get. So if the patient is responsive, if they're able to talk and you have ascertained that they are a diabetic, you see them at 12, their last meal was the night before because they just weren't hungry in the morning. Did they take their medication? Oh yeah, I took my insulin this morning. All right, so they're probably the insulin is taking whatever leftover sugar is in the blood and is metabolizing that, so their blood sugar is really low. So what you can do is you're gonna go into the medical kit. Carmen, can you find the glucose, please? We should have a glucose tube. And I think we have multiple in here. So what you can ask is you can ask them, do you have anything on you? And sometimes they'll have a sugar candy. Perfect. If not, go into the medical kit, take one of those and squirt it under their tongue. Don't squirt the whole thing, it's a lot. It would be like somebody taking the Ready Whip can and you opening your mouth and just filling the whole thing. It's hard for you to actually take that all in. So give them like a quarter of the tube, let them close their mouth, swallow it, give them some more, a little bit of water. And they'll start to feel a little bit better if it is the hypoglycemia within maybe 2 to 3 minutes because it's pretty fast acting. You might need to give them multiples, but once you give that tube, call over for triage, say I think I have hypoglycemic patient, I need somebody to come over, and they'll do a quick needle stick and they'll find out. I had a patient a few years ago that was hypoglycemic, we gave him 2 of those, and when medical came over, his blood sugar was in the 40s. So very, very low. So I can only imagine what it was before we gave it to him.
And doctor, that can happen to patients like, even if they're not diabetic or anything like that, it can happen to patients just if they haven't eaten and
Yeah.
things like that.
Yeah.
So that's more along the lines of the teenager that I had a couple weeks ago that I sat her at. She was super dizzy. So get her a cup of water, go get doctor,
Yep, there's a number
go
of
get
reasons.
mom, have you eaten today?
Yeah.
So
So that's if the patient is responsive. If they're unresponsive, you want to be careful with you don't want to just stick something in their mouth because they can choke. So what it says glucagon, that's going to be intramuscular. We don't have that, so call over. Just say patient is unconscious. I suspect it is hypoglycemia, and are we in agreement? Code blue would be okay for that.
They're unresponsive. They're unresponsive.
If they're unresponsive. And then you wanna go ahead and get their blood pressure, you wanna get the oxygen tank.
We're gonna have to cut it short. Maybe we can finish at the next meeting, because we'll have a little bit of time.
Sure.
How much- do you have any money?
And we can bring the pedo kit for that one too.
Oh, yeah, okay.
We had sent ours to pharmacy today.
So if we could all go over, let's pick on the specialty side today. If we could run over to specialty and we'll run a quick drill, make sure everybody knows where everything is. We're actually gonna be calling the drill, so you will have medical come rushing